So, good afternoon, Chair Simpson and Ranking Member Pingree. I apologize, I have a little bit of a cold. I just stuffed my whole mouth full of candy, so let's hope that that doesn't come off too much. First I have to say it's a real honor to be here. I'm so grateful to the staff who continue to make time for us, even despite, flight challenges and things like that. Today, I'm asking you to really invest in our Urban Indian Health Organization line item. And for the first time, I'm asking for over $1 billion. So $1,093,999,000. I'm saying that number out loud because it's slightly different from my written testimony, and I want you to know that I'm aligning with our national tribal budget formulation. That's very important. But I have to ask for this money because we all agreed that we wouldn't go backwards. And trust me, I know how hard you have fought to make sure that that doesn't happen. Especially you, Chair Simpson. I've heard it throughout Congress, how hard you have fought for us to maintain our funding. And at the same time, like you said, Ranking Member Pingree, I am very concerned about the Medicaid cuts because the Seattle Indian Health Board is not only an urban Indian organization, but we're the first urban Indian organization to become a federally qualified health center. And that means we are dependent upon this third-party revenue to balance out the IHS budget. I know that the federal government understands that IHS has been underfunded since its inception. I also know that the federal government has utilized other resources through SAMHSA, through third-party revenue, billing revenue, through other funding entities to help us offset that budget shortfall. Well, that's not happening now. Now those funds are being threatened. And the thing is that we all made a commitment to one another. Chair Simpson, you said, I need you to be a good steward of these resources. So I'm going to tell you what we've done. So our residential treatment program, 92 beds, with 15 beds dedicated to serving pregnant and parenting people, opens on July 11th, and I'll invite all of you to that grand opening. We're incredibly proud of that $38 million project. I want to tell you that it's $38 million because I've recently heard that Secretary Kennedy is making $1 billion investment in infrastructure, right, in IHS. And that they're going to use the 1993 priority list to be able to distribute those funds. So if our 92-bed residential treatment program costed $38 million and has taken us roughly 5 years to get going, think about how far $1 billion is going to go. That's not very far. Think about the fact that we have a priority list from 1993. Why is infrastructure important? Because building infrastructure allows us to use innovative approaches to diversify our revenue streams, right? One of the things that we bond over is the fact that, business is important and we can function in an effective business manner. The Seattle Indian Health Board, we've been able to establish our first LLCs and our subsidiary businesses to begin to diversify our revenue streams. This would have been impossible without the infrastructure investment in those ARPA funds. I hate to even bring up the $1 billion investment in infrastructure because urban programs are not eligible. And I never, ever want to take resources from our tribal partners. They've been waiting since 1993. And at the same time, our urban programs are trying to serve those 76% of American Indians, Alaska Natives living in urban areas. So we need to make sure that we actually have some funds that are dedicated to that. And back to what Abigail's point was, is we have magic happening in Indian country. We have always been your greatest return on investment. We need to take a look at those wins, and we need to reinvest our resources into those wins. When you think of a program like Seattle Indian Health Board that started with one family medicine residency program, and now we have 32 training programs, 32 learning programs, that should equate to an additional investment. See where I'm coming from? Those are the things that have value. I just want to say another thing that you've really invested in is getting traditional new medicine to become billable practice, particularly Representative Elsie, and circulated that letter that got 4 states to be approved for that. In the state of Washington, I want you to understand that because urban programs are not eligible for 100% FMAP, we're likely to be removed from that option being eligible, which is so sad because the Seattle Indian Health Board is the only organization that has a proven mechanism for that billing system. We have to go back. We now have real data. The CBO score can be real. and use that data to make sure that 100% FMAP is implemented in perpetuity. I need your help on this, guys. I can do magic with that money. Just help me get there. Thank you very much.
Thank you.